morning. You're listening to Complete Health with Dr. Mike Rogers. I'm Adam Owens, sitting in today for April Rogers. Mike, good morning.
Good morning, Adam. How are you?
Very good. Thanks for coming in this morning. Mike, what are we talking about on the show today?
Well, Adam, we're going to be talking about, there's a substance out there that some say is just as addictive as alcohol, cocaine, and other narcotics, causing medical conditions ranging from heart disease, diabetes, and cancer, and it's perfectly legal.
Okay.
All right. This substance creates cravings that stimulates the dopamine receptors in our brain, just like the drugs mentioned, and contributes to the most prevalent chronic disease in both children and adults worldwide.
Okay, and it's legal, you're saying?
And I'm telling you, it's legal.
What are we talking about here, Mike?
It's sugar. And I know you have some issues with sugar. I see every once in a while on Facebook a Facebook post of you and Jolt Cola.
Yeah.
I saw a Facebook post with you and a box of donuts from Seattle.
Yeah. All right. Well, this will be good. This will be an education, Mike. So
and on today's show, we're going to discuss this chronic nemesis of dentists.
Of course, right. Who better to discuss this with us? All right, Mike. Well, let's get started, Mike. So let's start with the basics. What is sugar, and what are the different types?
Okay, sugar is a sweet carbohydrate, and it comes in a couple different types. It's monosaccharides, which are simple forms of sugar, such as glucose, lactose, and fructose.
Yep.
The other is, a disaccharide, which is combined or linked groups of sugars. And for example, glucose plus fructose equals sucrose, which is table sugar.
Oh.
So it's a combination of the smaller ones put together.
So simple sugar is the stuff you might find in milk or fruit
or blood sugar.
Okay.
Is the glucose.
But then table sugar is actually kind of a combo of a couple different types of sugar?
Exactly.
Oh.
Exactly. And these sugars can be linked together into forming other things called dextrans and even starches.
Okay, are they even sweeter? Like, do I want that for my coffee or no?
Not necessarily, but once again, starch is all these are carbohydrates.
Okay.
And sugar is a basic form of a carbohydrate, so that's why we always discuss that.
So carbohydrates can actually contribute to tooth decay?
Yes. Once again, because these carbohydrates break down into simple sugars. And so as we start to digest, and as you well know, and as everybody may well know, digestion starts in the mouth.
Mm-hmm.
So as things start to break down in our mouth, we're feeding this bacteria right off the bat. We're giving them food and energy to do what they do.
Which results in tooth decay, gum disease.
And the likes right there, not to mention other issues that we're going to go into a little bit today, elsewhere in the body.
So some of the things, sucrose, you said, I recognize that. Fructose, I recognize that. But are there other, I know that sugar can appear in foods under other names sometimes. Are there some different names for added sugar in foods?
Yes, there are. There's over 61 different types of names for sugars that are added to food, such as sucrose, high fructose corn syrup, agave syrup, honey, barley malt, dextrose, rice syrup. All of these are just kind of name a few, but anything that ends in ose, there's sugar alcohols that can be. So we've got to look at our foods and what we're eating and putting into our body that can play a part in contributing to decay, gum disease, and the bacteria in our mouth, which can also lead to problems medically as well.
In the list that you rattled off there, a couple of things struck me: agave syrup, honey, rice syrup. I've seen these for sale in health food stores. Does that mean they're good for me? They're still sugar, right?
They're still sugar, and sugar is sugar. Sugar feeds bacteria. Sugar changes our blood sugars as well. It increases our glycemic index, or how our body has to deal with the sugar insult, so to speak. And so all of these things, regardless of how it's termed or labeled or formed, is still sugar.
Is there one type or another that is more or less harmful than the rest of them?
Well, that's a great question. What it is I look at sugar in as from a dental perspective, say, the most cariogenic, meaning the one that causes the biggest problem for teeth and tooth decay, is sucrose or table sugar. And what it is that's really where I'm going to primarily focus when we discuss sugars today, because what it is with sucrose, as humans, it has an ideal taste for us. It has an ideal consistency for us.
We love it.
It's the perfect sweetness for what we've
grown and adapted to want, right?
Exactly. And it's in a cariogenic or a cavity-forming matrix or potential. It does create the most potential for decay. It's the highest. Then as you go down like a pyramid or a reverse pyramid, fructose would be just below that, which is fruits and things like that, things you would find in fruits. And then other sugars ending in oses.
OSE, right?
OSE.
So sucrose, we talked about. Fructose, glucose is another one.
Right.
Okay.
Lactose, things like that. And then there's other ones that go down below it, which are less potential for decay as we move down this list. The reason this is so high is because it's got, as we talked about earlier, sucrose is glucose plus fructose mixed together, and in that it has a high energy bond.
Okay.
So when we ingest that, the bacteria, first off, they can break that high energy bond and actually absorb that energy that's broken from it. So now they're all charged up with high energy. Once that's broken down, what happens is now it's broken down into smaller sugars, the glucose and the fructose. And the bacteria can actually use that now for energy as well. It also helps form this massive biofilm plaque, meaning it's a group of bacteria that form in a mouth.
Well, they're all kind of partying.
They're all having, And as that forms, this matrix or this plaque formation, they're eating the sugars. They're producing their byproducts, which is an acidic byproduct causing decay and breakdown of tooth and bone structures. And then they're also growing, replicating, and getting more and more aggressive. Partying harder.
So it's actually not that sugar decays teeth. It's that sugar feeds bacteria. Bacteria have an excretion. They have a waste product, and that waste product is acidic, and that's what eats the teeth. Am I saying this right?
Yes.
Okay.
Yes. So it
sounds like a not so fun party, to be honest.
For them, it is.
Sure,
it is.
So how is fruit sugar, fructose, right? How is fructose different than sucrose? Let's say.
Well, fructose is different in a way, as we talked about the potential for decay. It's a little lower on the list, and then what happens there is. The other thing is, even though it can change our glycemic index or our blood sugars, what happens is our bodies, when we ingest the fruit, takes time because there's also endemic fiber to it.
Oh, it takes a little more energy to break it down.
So it takes energy, it takes time to break it down, so it's there and it's more slowly absorbed. The thing is with that, though, is that we've got to keep in mind fructose is a sugar, and it can be just as unhealthy and be as bad for your liver almost as alcohol.
Wow. We're talking with Dr. Mike Rogers here on Complete Health with Dr. Mike Rogers. I'm Adam Owens, sitting in for April this morning. When we come back, we will continue our discussion on sugars. Stick around.
Healthy teeth and gums for a lifetime? How important is it? At Complete Health Dentistry of Northeastern Pennsylvania, that is our focus. If your mouth isn't healthy, your body can be affected as well. Gum disease has been linked to heart attacks, strokes, and diabetes. And if your teeth and gums are in bad shape, it affects your ability to smile, eat, and live life to the fullest. You've worked hard. Isn't it time to take care of yourself? Turn to Dr. Michael Rogers at Complete Health Dentistry, where you and your health are our #1 focus. Take time for your health. Call Complete Health Dentistry at 253-5000 and schedule your new patient experience today. See how we can help you feel and look better than you ever thought possible.
Complete Health Dentistry. your health for a lifetime.
Visit us on the web at Complete Health Dentistry of NEPA.com.
Welcome back to Complete Health with Dr. Mike Rogers. I'm Adam Owens, sitting in for April this morning, and Mike joins me in the studio. Good morning.
Good morning, Adam.
We're talking about sugar today, and my question for you, Dr. Rogers, is how does sugar cause problems with our teeth, with our mouth, and then with our overall health?
Awesome question. As the bacteria break down the sugars, they get energy from it.
Right.
They become more active. They grow better, they reproduce, and they produce this plaque biofilm,
right,
meaning a mesh or overgrowth.
Big bacteria party.
A big bacteria party.
And they stick to the teeth, basically, right?
Correct.
Yeah.
Correct. And what we do is, in our office, one of the things we do is we actually pull this plaque biofilm off of the teeth and we show it on a microscope.
Yes.
So you can actually see the bacteria that you're developing in your mouth.
Creepy crawlies.
And we discuss that. How can we eliminate it, and how can we avoid that becoming a more significant problem? Then their waste products that they produce is very acidic.
Yep.
And this acidity is what creates the decay and the breakdown of the tooth structure and the supporting structures. And what I mean by that is the bone and the gums.
So beyond just the teeth, actually deep down.
Correct.
Okay.
Correct. And so what happens there is we're not only feeding the bacteria that create decay, we're feeding the bacteria that create a gum or periodontal disease that break down the bone and the supporting structures. These, as we've talked in other episodes, can also get into the bloodstream and create other medical issues. The more active the bacteria become, the more aggressive and the more damaging they become. And this puts our teeth, gums, jaws, and our whole body at risk.
Yeah, let's talk about some of the risks to overall health beyond just the mouth. Does sugar really affect the whole body like that?
It can. It can, and I'll start from the mouth going in. Mm-hmm. As we feed these bacteria, they become more aggressive and they can penetrate into the bloodstream because our blood vessels are only, say, a cell layer away from these bacteria. Mm-hmm. So it's very easy for them to penetrate. And once they get into the bloodstream, it's called an oral bacteremia, meaning it's an inflammation or infection of the bacteria from our mouth into our bloodstream.
Into the body.
Correct. Ooh. And studies show that it creates heart disease, heart attack, stroke, diabetes, cancers, Alzheimer. All of these things can come from bacteria getting into our bloodstream. But also, to answer your question, sugar can create medical issues directly as well. Mm-hmm. It increases the risk of insulin resistance, diabetes, and metabolic syndrome. It has been linked to heart disease, heart attack, stroke, Alzheimer's disease. Cancer is also linked to it. And it increases the recurrence risk and recurrence rate of cancer, and also it lowers the survival rate after being treated for cancer.
I heard you. Heavy.
It is.
That's heavy, man. I don't know about this candy bar now all of a sudden. I heard you mention a term, metabolic syndrome. What's that?
It's actually a condition that consists of a cluster of problems or symptoms where people exhibit, say, an apple-shaped body or a pear-shaped body stance or frame.
Okay.
And where their waist is actually, or their belly is wider than their waist.
Okay.
And the waist size in women is greater than or equal to 35 inches. In men, it's greater than or equal to 40. High total cholesterol, greater than 50 in women and over 40 in men. High triglycerides, 150 milligrams or higher. High blood pressure, anything over 135 over 85. And high blood sugar, over 100.
So these are all symptoms of metabolic syndrome.
Correct.
And this metabolic syndrome can be kicked off and or exacerbated by the consumption of sugar.
Correct.
Wow.
And it occurs because, one, it increases the blood sugar, increases the insulin in our body. Mm-hmm. And it causes the insulin to really stop working the way it's supposed to. leading to this insulin resistance, diabetes and the metabolic syndrome, and even Alzheimer's. There's really a close link with sugar and Alzheimer's as well. It increases the systemic vascular inflammation, which can lead to heart disease, heart attack, and stroke. It increases the inflammation and blood sugar feeds to cancer cells, and all of that creates that whole cascade of issues that we just discussed, where it can increase your likelihood of having metastatic issues or having other problems with cancers.
Dr. Mike, on the side of a bag of chips or a box of cereal or something, you see all these facts and figures, these recommended daily allowances for different vitamins and fat and calories and things like that. But I've never seen a recommended daily allowance for sugar. What's the recommendation for how much sugar a person should have in a day?
Just going by the American Heart Association's recommendation, men should have less than 9 teaspoons per day, or 38 grams.
Okay.
Women should have less than 6 teaspoons a day,
okay,
or 25 grams. And children, because of the age range, depending on what it is,
yep,
anywhere from 3 to 6 teaspoons a day, which is 12 to 25 grams.
Okay, so put this in perspective. What's that like in terms of, I don't know, like a can of soda or something?
Okay, so just for argument's sake, one can of soda has 11 tablespoons.
Oh, come on.
Or 11 teaspoons.
So that's one can of soda, and you're over the American Heart Association recommendation for an adult man in one day.
In one day. So, and we're just talking soda here, but
yeah,
people will go, well, what about my energy drink? What about Gatorade or something like that? Those too are filled with sugars. So we've got to be cognizant that even though it seems like it's a bit more beneficial aspect to go,
yeah,
it's sugars everywhere.
Sugar is sugar.
Sugar is sugar.
You can look at the side of a bottle of soda or a thing of yogurt or something, and you can see how many grams of sugar are in a serving.
Correct.
And I want to say too, be careful, because sometimes one container can have 2 servings in it. And it'll show you, 8 grams of sugar. That's great, but that's per serving. So if you eat the whole container, it's actually 16 grams. Right? I've fallen into that trap many times.
And the other things looking that we think are healthy. There's a leading brand of yogurt out there that has 7 teaspoons of sugar in it. So I mean, right there, you're over the daily limit for, say, women and children.
Yeah.
And pushing the daily limit for men. A breakfast bar with real fruit has 4 teaspoons of sugar in it.
Ugh.
So I mean, you think you're eating healthy, you think you're taking up things that are doing you good, but what it is it's still detrimental. It's still additive.
We're talking about sugars with Dr. Mike Rogers on Complete Health. We're going to take a break, and when we come back, we're going to talk about the use of artificial sweeteners, as well as some of Dr. Rogers' healthy suggestions for avoiding sugar and staying healthy.
As we begin a new sports season, Dr. Mike Rogers of Complete Health Dentistry of NEPA is reminding athletes of all ages of the importance of wearing mouth guards. Mouth guards are used to protect your teeth, gums, lips, and jaw from injury and help redistribute forces from a blow to the head, preventing a lifetime of future dental problems due to broken or knocked out teeth. A mouth guard should be worn even if you wear braces. To support our local sports teams, our office will be holding several mouthguard clinics. You can get a custom-fitted mouthguard for only $45. Just mention this commercial and the sport you play. These mouthguards can be made with your school colors. Call our office for more information and to reserve your time. 570-253-5000.
Complete Health Dentistry, transforming your health for a lifetime.
Welcome back to Complete Health with Dr. Mike Rogers. I'm Adam Owens, sitting in for April Rogers this morning, and Dr. Mike joins me in the studio. Good morning.
Good morning.
We're talking about sugar today, and Dr. Mike, I'm curious, and I think I probably already know the answer to this, but how are we Americans doing at keeping sugar out of our diet?
Not really good.
Oh.
In 2014, a Harvard study actually indicated that 1 in 10 people get more than 25% or a quarter of their total calories per day out of sugar. Yeah, exactly.
Yeah.
So sugar's everywhere. Drinking 1 can of sugar or 1 can of sugar,
Yeah.
1 can of soda a day increases your risk for heart disease by 3 times.
Whoa.
Exactly. So this is significant that we're ingesting all this sugar.
Well, if I just have a can of soda, can't I just like have a glass of water or something after that?
Well, that's a great question. It takes up to 32 glasses of water to counteract the sugars and everything else that's in a can of soda.
32 glasses of water.
Right.
That'd take me all day.
It would, and then some.
Yeah. Oh, wow. Okay. Well, now, what about, artificial sweeteners, the pink and blue and yellow little packets that I see?
Not all of them are natural.
Yeah.
So we've got 2 things there. One there's natural ones, there's artificial ones.
Okay.
And the underlying concerns with them, a lot of times is the carriers, because these are so sweet. It's not filled just with that sweetener. It's filled with carriers and additives to give it bulk.
Okay. Stretch it a little bit. Yeah.
Exactly. And so these high intensity sweeteners within the packet also can feed the bacteria in a different way.
Oh.
It can make them worse, or it may not feed them as well, but still it can create an issue. But one of the big things that it can do is it can change the flora or the bacteria in our digestive tract. Which can create a whole host of other problems medically, because we know that if you change the gut flora,
Yep.
it changes how our whole body digests things. So by adding all these multicolored packs to our diets, we have an idea it's going to affect it. It's just everybody's going to be affected differently.
What are some suggestions then, if we're doing such a lousy job staying away from the sugar, and if the artificial stuff isn't quite going to cut it? What are your suggestions to keep sugar at a minimum and to keep ourselves healthy?
1, eat a well-balanced diet.
Okay.
That's really where it should start. Eat fruits and vegetables. If you're going to do sugars, do them naturally. Like we talked about earlier, the fructose itself is going to be ingested, but it's going to be spread out over a longer period of time, how your body absorbs it because of the fiber.
Okay.
Drink half your weight in ounces of water every day.
Okay, so I weigh 220 pounds, so I should drink 110 ounces of water a day?
Correct.
How much is that? How many ounces in a gallon?
128.
Okay, so I would be drinking nearly a gallon of water a day, ideally.
Ideally.
Huh. All right, I'll get to work on that.
Yeah. Eliminate soda.
Okay, yep, I understand why.
Limit snacks and sweets. And here's the thing for some of the people out there as well. Avoid chewing tobacco, primarily for the obvious reasons of preventing oral cancer.
Yeah.
But also because most of them contain high amounts of sugar.
Really? Chewing tobacco has sugar in it?
Lots and lots. A
Really?
lot of sweeteners.
Huh.
And a lot of times this not only promotes the bacteria that are there, but it creates gum disease, cavities, and just what we were talking
In
about
an
before.
environment where the tobacco is already doing not great stuff to your mouth.
Exactly.
Huh. Okay. All right. What do you recommend for, home care, dental health habits to keep sugar out of our mouths? Okay, let's say what is Halloween and I just totally chowed down on, my little brother's bag of candy or whatever. What can I do?
1, brush twice a day.
Okay.
As a minimum. Floss at least 1 time a day. Rinse with an antibacterial rinse or a fluoridated rinse. See your dentist twice a year.
Yeah.
Decrease your intake of sugar and carbohydrates.
So, right, because carbohydrates break down into sugars.
Drink more water.
Yep.
Or if you can't brush right then and there after you have something sweet or sugary or added sugars to your drinks, drink some water afterwards to flush it. Use xylitol products at least 3 to 5 times a day.
Okay, so xylitol is a sweetener, right?
Correct.
And is this, we've been talking about all these artificial sweeteners and these different alternative sweeteners. Honey is still a sugar. Rice syrup is still a sugar. But xylitol, you're actually recommending to use?
Yes, I am.
Go on, tell me about this.
There are some sweeteners out there that can be helped, or that can actually help our mouths and decrease the cavity prone or the cavity bacteria and the bacteria that create gum and bone loss in our mouths. And the one that we're talking about now is xylitol.
That's spelled with an X.
Yes.
Okay.
And it's an all-natural sugar.
Yeah. It is still a sugar, or it is a sweetener, or
Yes, it's both.
Okay.
And what it is all natural. It's made from the fibrous parts of the plant.
Okay.
It's anti-cariogenic, meaning it prevents decay.
Cool.
And it also limits the plaque buildup, what we were talking about
plaque
before.
party.
The plaque party.
Yeah.
And the reason here is the bacteria can ingest it, meaning they can eat it,
Yep.
but they can't digest it.
They can't process it.
Right. So in essence, the bacteria in our mouths start to starve. So you're feeding them, but they're not able to, so they're dying.
They're not actually able to make any use or energy out of what you're feeding them.
Correct.
They're eating it, but they're going, hang on, this is empty stomach. Oh no, and they die. That's the sound they make, I believe.
That's the bacteria sound.
Does xylitol raise blood sugar levels?
Nope, it's actually safe for diabetics. And so it doesn't, most diabetics that I have can take the xylitol products and it doesn't affect them at all.
Okay, but what is it? It's twice the calories of sugar, right?
Nope, 40% less calories than sugar.
Okay.
And some people even say it's sweeter than sugar, and so you don't need as much. It kills the bacteria in the mouth, and it feeds friendly bacteria in the gut, what we were just talking
so
about
it
before.
actually does good for your guts.
It does good for the gut because since it's made from the plant fiber, the fiber, when we digest it, is actually beneficial to gut bacteria, and so it helps them.
So how much xylitol per day are we talking about to kind of, create that decay prevention?
Well, it's not one-to-one, meaning if you were, as I said, some people say it's sweeter than sugar.
Right.
So it's not a one-to-one. If you had 2 teaspoons of sugar in your coffee, it's not 2 teaspoons of xylitol. It's usually far less than what you need from regular sugar to stop or prevent decay. On average, 6 to 10 grams per day is recommended to reduce or stop decay.
Okay.
So 1 level teaspoon is 4 grams.
Okay.
There's a strategy, though, with xylitol.
Go on.
3 to 5 times it shows to reduce the bacteria and decrease the potential for their problems.
Yeah.
So if you brush with it, because they make it in toothpaste form, powder or crystal form, in mints and lozenges, and so we can
Chewing
use
gum,
it.
right?
Chewing gum.
Yeah.
And so if you brush at night, in the morning with it, and you brush at night, that's twice that you've used it.
Yep.
If you chew gum with it during the day, that's another time. If you take some of this and put it in your coffee or in your water,
Yep.
I've got some patients that drink water with this in, they're decreasing their bacteria count throughout the day. And so what happens is
Sort of a constant assault on the bacteria.
right. So you're starving them to death,
Yep.
as we talked about. And once again, it can be found in granulated form in mints and lozenges, and you can use it.
So what's the downside here to xylitol?
The downside is you can't bake with it.
All right.
It doesn't, you're not going to use it in a brownie or a cake.
Okay, it doesn't bake the way sugar does.
Correct, but you can use it in hot liquids and things like that.
Okay.
And the other thing, just like chocolate, it can be toxic to dogs.
Okay, good to know. Good to know. We've been talking to Dr. Mike Rogers on Complete Health. I'm Adam Owens, sitting in for April this morning. Dr. Rogers, thank you for spending some time with us.
Hey, thank you, Adam.
Complete Health Dentistry.